Hi, it's good to have you join me today. Thank you so much for taking your time to be here. Um, I'm going to talk a little bit about diabetes. Actually, I'm going to set a timer so that I do not exceed my time. I'm trying as much as possible to keep these videos very short, but very informative so that you don't have to sit for a long time watching or having to play back for a long time. But as much as possible, I want to make sure that you get all the information you need. All right, thank you so much for joining me. My name is Edith. Oh, my nose keep itching. I don't have corona. All right, so my name is Edith. I'm a registered nurse and then a nursing professor at the community college here, and I love what I do. I love to teach. I love to talk about health related issues, and I love to bring information to whoever needs it. So today I'm going to be talking pretty much about diabetes. So in the past we've talked about um, cancer. We've talked about what was the first thing? I forgot the first thing. Oh, STDs. And today I will be talking about diabetes. So diabetes, a lot of people have heard about diabetes, and just so you know, today's Father's Day, and it means so much to me because I had lost my dad to diabetes, and it was about 16 years ago. I didn't know what I know today, and it hurt so bad, but the reason I actually found myself doing this, for those of you who know me, I used to be a math teacher and I loved it, but then when my father died, I felt the need to be an advocate for people, for patients, for their families, to help them get the information, the necessary education, to help them, enable them to be a part of their treatment team, so they can actually understand what's going on and how to actually play a role in managing their own health. So that's actually how I got to into this whole patient teaching and all that. And I really appreciate it because I get lots of feedbacks. I get tons of questions, and it will surprise you how much people do not know about these things. You would think everybody knows. Yes, everybody has access to the internet, but then not a lot of people actually understand this information, and that's why I'm bringing it to you. I'm breaking it down. I'm not trying to treat. I would not treat you. I would all. The goal of this is to get you to understand some of this diseases, especially the ones that are preventable, and that way you can identify the signs and symptoms and seek immediate medical attention. Okay, so today I'll be talking about diabetes. I'm sure a lot of us have, in one way or the other, known someone who had diabetes, known someone who died of diabetes, known someone who has been diagnosed, or you probably do have diabetes. So today I'm going to be breaking it down. All your questions, you can send me the questions by inbox or whatever is more appropriate for you, and I will gladly answer them. So today I want to talk about diabetes mellitus. So diabetes is just a group of metabolic disorders, and I call them a group because it's not just one. I know some of you probably know, oh, just diabetes, but there's more than just one type of diabetes. So it's all about less inadequate insulin production or utilization, or just an insulin imbalance in the body. So what happens? There are two types of diabetes. The first one is thank you all so much for joining. Thank you for coming around. I really appreciate you. The first type of diabetes is the type 1. Back in the days, it used to be called juvenile diabetes, and that's because we saw them more in younger children. It was diagnosed in little children, not until recently. It's now known to be affecting everybody across the age board. So type 1 diabetes, it can affect anybody, and that is pretty much basically a situation where the pancreas does not produce insulin at all. So you can imagine you have a child who is always getting sick, they're always hungry, they're always thirsty, they're always tired, and God forbid you hear about someone who loses a child. It could have been that the child had diabetes, type 1 diabetes, that was not diagnosed. So type 1 diabetes, pretty much the pancreas, which is it's a gland that produces insulin. It produces the hormone called insulin. So the pancreas does not produce insulin at all. Now, what is the role of insulin?